This video is to document and for posterity to help me in case I ever deal with this issue again, and especially to help others that might be dealing with it because there is not a lot of information out there for this particular issue. This issue was a litter that had a necrotizing bacterial infection in their skin that became systemic and went through them, and it killed most of the litter. And I wanted to try to save the last three kittens if I could, but we didn't recognize what it was at first at all. And in fact, the agency that I work for said they had never seen it in cats before, hadn't seen anything quite like this. The vets that we were able to consult all said that if you suspect something like a MRSA or a necrotizing infection like this in kittens this young, there's just no saving them. It moves too fast. They're too tiny to treat. It's too contagious. They recommend euthanasia for the whole litter. And they just felt there's no way you can treat it. You just can't save them. And since I recognized what was happening with this litter, it's now been several weeks since I began dealing with this, 2 months almost, in fact. I have known of a couple of other litters. One was puppies, and the same thing. They lost almost the entire litter, and you really don't even know what they're dealing with until it's almost killed most of them. It moves very fast. So I'm making this video to help others, and if I have to deal with it again, this will help me remember what worked and what to look for. So we got this litter. They were 6 days old. This is December now, and I believe they were born on October 20th. I got them October 26th of 2020. This litter was born a couple of hours away from where I live in a garage. Sounds like it was an abandoned garage. Neighbors were keeping an eye on a pregnant female cat, feral, that was going in and out of the garage. Thank goodness, because they noticed she went in one day, didn't come out for quite a few hours. When she came out, she looked skinny, so they knew she might have had her litter in there. That she apparently just dropped the litter as she ran. They were spread. There were 7 kittens, and they were spread all around the garage. So she didn't clean them. She didn't take care of the umbilical cord. So she probably was either sick, feral, very young and inexperienced, or all of the above. But what she did was just, drop the litter, try to get away. Uh-oh, here comes another one. So they were spread out. They were in this garage. They didn't even get to nurse. So no colostrum, basically no immune factors. And it was probably several hours, possibly even overnight, before people came in, gathered the 7 kittens up, put them in a box, and then tried to find a rescue agency that would take them, which is how they ended up coming to me. By the time I got them at 6 days old, 4 had already died. And the rescue agency director held on to them a couple more days to see if they seemed stable, and they did. And she didn't know exactly what had killed them. They had ended up developing blood in the urine and just were not eating. And so 3 were already dead. 1 had to be euthanized. Then I got the remaining 3. There was an orange male we called French Fry, a darker gray tabby we called Aria, and a lighter gray tabby we called Sansa. Aria and Sansa, obviously females. So this is the day we got them. That was French Fry, the little male. And this was, I believe this is Aria. Had I been paying attention back then, which I didn't notice whatsoever, but in retrospect, going back and looking at the pictures, I can see that their toes were really, really pink and kind of lumpy looking. But I would not have picked up on it, back then. There's so many reasons they could have slightly swollen toes. And anyway, these are the pictures of now looking back that I will always now look for. I will always inspect the kitten's toes a little better because of this litter. One other thing I noticed about some of them was some of the pink areas actually appeared to be very, very red, much pinker and redder than I thought was normal. But But I also thought every litter's different. All these kittens are different. I don't know if it means anything. This guy in particular, his nose was so vividly pink. If you can see one of my kids behind him, that's a human lips, and look how much redder his skin was. But then I thought, oh, they're so young, they're newborns, thin skin, whatever. But here, when I look back on the pictures at 7 days old, I can already see, the toes look actually swollen and very sore. So he right off the bat seemed to have this infection starting worse than the females. He slept a lot. He didn't eat very well. And by 8 days old, I began to notice, what's wrong with him? I really looked him over. This was actually a pustule right on his urethral opening. And that was odd. And then I noticed, one right here at the juncture of the top of his leg, his groin, if you will. And the more that I looked, I'm serious, within an hour, I would check again, and there were more. It was happening so fast, and I couldn't tell if it was my imagination or I had missed them the first time. But this was actually a little fluid-filled pustule. This was up here on the toe was one, and it was very hard to get pictures of them, but they were basically all over his toes, his abdomen, his urethral opening, down the backs of his legs. And like I said, within hours, every time I looked, there were more. So this is what his toes were starting to look like. And by this time, I was starting to get really suspicious, like, oh my gosh, I think these are pustules, which means I think this is staph. And I actually have some experience with these kinds of skin infections in humans, in children. So I was pretty sure that's what I was looking at. However, as I said, this is apparently very uncommon in cats. And everyone that I consulted here locally said that this doesn't happen to cats and they've never seen this in cats like this. So I was told, just wait and see. And I said, I think we need to put them on antibiotics and do some skin treatments and oral antibiotics, topical antibiotics. But I was told, no, let's just wait and see. That's not what was wrong with the other kittens, so that doesn't make sense. I think it probably was, but nobody caught it, just like I didn't catch it at first. This video in particular is something that I am going to be very careful of from now on. I assumed that when I was told that no, cats don't get staph or MRSA or necrotizing skin infections like that, this has to be something else. I assumed that I was seeing a neurological problem here because the other kittens were walking better, not wobbling, not shaking. And every time this guy would try to walk, he would just stand there and shake and wobble and tremble. So this led me astray from the real issue. And I would text the director of my agency and say, yeah, there's something else going on. He's not eating and he seems to have a neurological problem. He doesn't have any balance. Now that I looked it all back over and as time went on, I realized there was no neurological problem. He was in pain. His feet, he was trying to put weight on his feet, and this necrosis in the toes was so incredibly painful, it hurt. So he was shaking from the pain. And after a few days, I came to recognize that. So this is by 8 days. In the morning, he had had a few more of the pustules, and I had decided, okay, I'm going to try antibiotics, oral antibiotics. I mean, what do we have to lose? But it was too late. I'd already given him one dose, but within 2 hours of checking him over and everything looked pretty much the same, within 2 hours, his arm was becoming completely necrotic, and it was very painful. So he did not make it. And this was a really, really hard lesson for me because I just can't help but think we could have saved him if I had known, if I had been sure that's what we were dealing with, if I'd had the confidence to say, oh, yes, I do. It looks just the same in people. That's a staph pustule. This is going to spread. These are the medicines we should try. But I didn't listen to my instincts, and we lost this guy. So that was at 8 days. So then, of course, I started examining the girls. And this is Aria. She had a really thick pimply looking pustule on her head, which was not a good sign because they still have soft spots and it could get into the brain. So I was really dismayed to find that. And then I started looking over their toes and really looking them over. You can kind of see a hint of the bump on her head right through the fur there. Her belly was a bit redder and her toes were a bit redder than they should be. And I got a couple pictures. This is 9 days again. The toes were really swollen. I mean, that one sort of middle toe is as big as two toes easily. And that crusty brownish looking thing, I believe was like a resolved pustule. It had already ruptured and it was becoming a scab. So I was beginning to see, oh my God, they have it too. And it was beginning to spread. The day that I started paying attention, just like the boy, when I'd go back and check later, there was more. So I got permission from my agency and started putting them on oral antibiotics on the 29th. And this is cephalexin, which is also known as Keflex. I had 500 milligram capsules on hand. So I broke one open, dumped the powder out, and would take just a minuscule amount, I don't know how to measure it. We didn't really know how to measure dosages at all. So I have a dental tool actually that's sort of a dental scraper like your dentist uses. It's got like an arrowhead on the tip. It's not the pokey long hook thing. It's like a little teeny tiny arrowhead. So it's almost like a flat spoon. So I used that just to scoop up the tiniest amount of powder that would fit on the end of that. And then I would rinse the nipple in water and I would stick the powder to the tip of the nipple and then feed them their milk and they would just swallow it, right as the milk came out. So the Q-tip is for perspective on the amount that I was giving kittens who were about 3 ounces and 4 ounces at 9 days old. So we tried to consult with a vet over the phone, and they said there's just really no way at that age and weight, and how advanced the bacteria already was. There was just no way to really know what was the right dosage. So I just sort of winged it. But here's a picture of what it looked like. Basically, I sort of coated the tip of the nipple really with the capsule ingredients. So this is Aria. I'd already started the oral antibiotics and I kept watching her and checking her. This is 9 days. It's hard to tell from these pictures, but this arm was starting to get purpley looking and really dark in some areas. So I believe what I started with here was just soaking the arm in Epsom salts to see if it would help the toes and the arm. And I thought at the time, I'll just start with the most affected areas. And yeah, this picture shows it a little better. That arm was much redder than anywhere else on her. And definitely they don't love the Epsom salt soaks. When it's a skin infection, it hurts. So from that picture there to just a couple hours later, her both feet became red. A patch on her abdomen became very red, and she began to wobble and shake just like Cheeto had. Did I say his name was French Fry earlier? It was Cheeto. We had another orange French fry once. So anyway, this video is pain management. She began to be in so much pain. She also quit eating. She began shaking and wobbling, and that's when I realized, oh, that's pain. That's not neurological, because I already knew she was neurologically normal. So what I did here, I do have an invention for pacifier that I made, a bunch of nipples wrapped around a fur piece on a stuffed animal, but she needed something more mobile. So I just took a syringe, put a nipple on the end of it. She was not hungry. She wouldn't eat. She just needed to suck because she was really in pain. She was yowling and crying. So when I gave her this makeshift pacifier, she was twitching and she was just sucking so hard and intensely. And if I started to say, maybe she's hungry and put milk in it, no, she didn't want the milk. She needed to suck for pain relief. So So you can see how red it was getting. You can see that she was really in pain. I mean, think about if you tear a hangnail on the side of your finger or thumb, and then it gets sort of irritated, puffed up, inflamed. Maybe it's going to get infected. Your hands encounter so much bacteria that it very quickly swells up and gets sore. Those things are so painful. Imagine all your toes, just all of them infected and painful, and you're that tiny. Anyway, here is another picture where I was trying to show that for some reason one side of her torso and belly were also very red. And I believe at this point, I had just tried soaking the arm and using a cloth to get some Epsom salts on her. Yeah, there you can see how red it was just in that area. So this must have just been the path that the bacteria was taking through her body, spreading from that arm downward. It's weird that it started by coming through their toenails and their feet, but maybe that was just because they were born in a garage and never got immune factors from mom, and it was just the quickest way for the bacteria to get inside of them. I don't know how this normally works, but that is definitely where it started with this whole litter. Well, at least the 3 that I had. So this is what I decided to do. I said, you know what? I'm going to soak all of her that I can, her whole body, because I don't know where this is spreading, where it started from. So I first got a bowl, and it's Epsom salts at the ratio on the bag, and I decided to soak them in it and hold their heads up out of it. And I would stand there as long, for a human, if one of my kids had something like this on their hand, a cuticle or a smashed toe that really I didn't want to get infected, 20 minutes. So I stood there and kept her in this nice warm Epsom salt soak for 20 minutes. And then when I took her out and went over her, it was pretty amazing. The redness was dramatically reduced. The swelling was dramatically reduced. However, I did notice that that arm still remained very dusky. And I became concerned that a patch of the forearm and the thumb on that side were actually already necrotic. And I didn't know if it went all the way through, but I could definitely, it didn't clear up with this first soak. And that thumb also had sort of a stripe of purple. So it looked like necrosis was actually starting in both front paws to some degree. So I decided that the Epsom salt soak, I definitely felt like I saw some improvement. So I was going to continue that. This is Sansa, the other kitten who didn't seem to have it as badly. She actually had pustules and bumps all up her spine that weren't as visible, but you could feel them. And her toes, she had a few on her toes, but she seemed to be the least affected. Now, this is Arya again with that bump on her head. I felt like after I did the first day, when I realized she was in real pain, she was not eating, she was getting shaky and wobbly, I just got very, very motivated. No, I'm going to try to save her. I don't want to lose her too. Like her brother is such a painful, painful process. And you know what? I know what to do for this particular problem in people. So let me try that on the kittens. I'm going to try everything I can to save her. So the very first day I started treatment, I did 3 or 4 Epsom salt soaks. I stayed up. I got up and did one in the middle of the night. I did it for 20 minutes at a stretch. I was already bottle feeding them every 2 hours around the clock anyway. So you can see in this picture that toe there on the left, her left hand. I know it's not a hand, but her left paw. You can see the purplishness there, and you can see the large, large middle toe. I mean, it's the size of 2 toes. And the bump on her forehead also was becoming a little bit more pronounced. This is Sansa after the first day of 3 or 4 soaks over 24 hours. Her paws look pretty good. I recall she was very red, the paws, the mouth, the nose. Her abdomen was starting to get dusky too, and this looked pretty good compared to how she had looked. So this is after probably the third soak, and I believe what I was trying to show here was that the more I soaked her, the more I began to notice the lump getting bigger on her head. And it was really hard to show the size and scope of it, but it was soft and mushy like a blister. And where I'm running my thumb right there, it was actually the size of a dime or maybe a nickel. And it was the whole side of her head there, from right over where an eyebrow would be to the, whoops, oh, I messed it up. Anyway, it was big, and it was that whole side of her head, and it sort of went over the edge of her head. So it was like a very big, soft cyst or mass, and I was very concerned about that. It almost seemed like the Epsom Salt Soaks made the bacteria relocate and migrate to her head, because obviously I couldn't soak her head. So it was getting better everywhere else, but it seemed like it was moving to her head, and I was very concerned. Could she still have soft spots? Could it get into her brain? How bad could this get? But it was very, very, and when I moved the fur, you could see that that side of her head was very dark red, very dusky looking. So there was no doubt that it was something else. It was the same thing. It just started moving and concentrating up to her head. And like I said, very mushy. Felt like a big blister. All right, so this is at 10 days. Her whole head shape started to started to be affected. It started to sort of give her a conical shape to the top of her head. And these pictures are with me continuing 3 times a day, daily soaks and dips, and holding them in Epsom salt. And I began trying to take a damp cloth and put sort of a compress on her head for that big lesion on her head. This picture, I recall that it became sort of 3 massive lumps along her forehead, and they bulged out over her head, so they gave her sort of a squished face appearance. And I took a picture from the side so you can see they kind of hung out over her. They formed a shelf along the like her forehead, where her forehead would be. So this is Aria after another soak. This is October 30th, so this was like 3 days of soaks, 3 times a day at least. You can see, wow, the feet and even the little bit of abdomen that you can see through the fur, the swelling, the redness are massively reduced. This is also after continuing to be on cephalexin, Keflex. We did every 8 hours. And at the end of this video, I have written down everything I was doing on a card. So I'll go over it again then, exactly how much we were doing, what dosage, how often. I'll go over all of it then. But this was after a few days on oral Keflex every 8 hours. This is the 31st. So again, big improvement in the feet. The head is still oddly shaped. That lump was still there. I started to notice that if I tried backing off the Epsom salt soaks, the lesions came back, the redness came back. This is Sansa, and I recall now, the interesting thing about her was she would get them on the bottoms of her feet. Not sure they'll show up here. She would get them on the toe pads, and she also still had the ones going up her spine, but she never seemed to have it as badly as Arya and Cheeto had. And this is her definitely letting me know how she felt about the soaks and the exams. Sansa is very outspoken. You can see the toes look lumpy and odd, but not as massively swollen as they were, and the nails are not as forced out, as extended as they had been. They couldn't retract them at all before. This is Sansa. Just a look at how things were improving, and their eyes were starting to open. And I was very worried that they would end up, having eye infections or even blindness if this infection had gotten into their eyes while they were still closed. So you can see her abdomen still a bit dusky and the inner legs, but the actual pustules on the paws are all gone. And then this is Aria. You can't see it very well, but that lump was still there on the head. The toes are still pretty swollen and red, but definitely improved. There, this picture, those, if they appear a little bit brownish, those are the dried pustules. And that toe took so long to clear up. That massively swollen. That toe was really bad. So at this point, I started trimming the fur down because when I would try to go part through her fur and comb through her fur, I began to notice that this arm was really dusky. And what I realized was that this spot, this patch, had truly been necrotic. It was dead. The skin was starting to crust and get really hard like a scab. And the thumb also, it was so hard to tell because it looks like there's a stripe of dark fur there. So I thought maybe the thumb was always supposed to be dark, but the flesh around it began to swell up and the actual dead dark flesh was getting scabby. So I realized, oh my gosh, that's actually dead tissue and I don't know exactly what to do about it. So this is where I had just cut the fur away to expose the purple skin underneath. So the best thing I could think of to do that wouldn't be too traumatic and also wouldn't help spread the infection was peroxide soaks. I didn't want to soak their whole little bodies in peroxide. But like I said, the infection, if I missed a couple of soaks in Epsom salt, it was just coming right back. The toes would swell up again, the bumps would start again. So I just took the areas where I saw necrosis on her. It was really the thumb and this patch on the arm, and I began soaking those in peroxide. And this is after a couple peroxide soaks. You can sort of see that the flesh, it ate it away. It's a natural debridement, and I didn't want to cut and risk spreading it. I didn't want to scrape. I didn't want to pick. So I just let the peroxide do its job. It was painful. I don't like doing it because peroxide is also harmful to new and tender tissue. To healthy tissue, peroxide is harmful. It's very abrasive. It's very harsh. And I wanted the toes to be healing. But it was the best thing I could think of to not let her get an infection that would now be caused from leaving dead tissue on her. So it did actually work really well. And at this point, there's already new fur growing back. The spots where the infection was bad, they lost the fur. It went bald. So these pictures are actually after I'd already been doing the peroxide and the fur was starting to grow back. I believe at this point also I was doing the Epsom Salt soaks 3 times a day or so, 4 times a day if it looked like it was trying to come back, anything was swelling up or getting pink again. And then I started the peroxide soak for the necrotic areas. And then when it was time to put them to sleep and they were beginning to sleep about 4 hours through the night without me having to get up and feed them, I was putting mupirocin ointment on the tips of the toes, on all the toes. I started putting it on this area that I had been soaking with peroxide. So I was also doing that topical, powerful antibiotic. This is at this point, what was the date here? November 1st. We also added doxycycline because it just wasn't clearing up like I thought it should be. So we began doing a cocktail 500 milligram capsule of doxycycline with the 500 milligram capsule of Keflex. And again, I was just taking the dental tool and the tiniest amount, the equivalent, basically the tip of the bottle nipple. And we were doing the Keflex every 8 hours. We were doing the Doxy only once a day for 7 days. The Keflex I did for 14 days. All right, this is just, I was monitoring the necrotic area. I used a marker to mark the borders and see if it was actually spreading. And at this point, this is when it was I think this is when it was starting to dry up. And I was really worried because you can see right there, that was a new pustule. So I wanted to see if the pustules are still coming and popping up occasionally. Is that changing? So I marked her arm to see if I thought that was growing or expanding or changing. And it did not appear to be. That seemed to have been resolved pretty just from the Epsom salts, actually, and the oral Keflex. That seemed to take care of that area on her arm. This is our Norwegian forest cat who was a previous foster. Actually, I had two litters for a little while here. So his litter was still in my house, and the new kittens had already been on antibiotics orally for over a week. So I was pretty confident they weren't contagious. And there was just no keeping him away from them. Anyway, the females wouldn't go near them. I thought that maybe they could smell the kittens had something really wrong with them. But once they'd been on antibiotics, he couldn't stay away from them. He just adores them. We have since ended up adopting him. We've kept him. And we still have the two girls. So there's your spoiler. Yes, I saved those two. They did survive. We did cure this infection. And he just adores them. We can't keep him away from them. So here's how I ended up doing the soaks that was much easier as time went on. This is just a measuring cup, a plastic measuring cup that I believe it came with an immersion blender. And this is Aria. I can tell because there's her little marked arm, and you can actually see kind of well there the lumped up dark tissue where the necrotic spot had been. So I would make the water nice and warm and mix it up really well to dissolve the Epsom salts and just hold them in it for 20 minutes. Believe at this point I was down to just twice a day because once we started doing the cocktail of 2 oral antibiotics, I felt like we could go down to just twice a day on the Epsom salt soaks. It got to the point that the kittens were just falling asleep in the soaks. It was very relaxing. When their lesions were fresher in the beginning, I could tell it was painful and they'd cry, but I'd keep them in the full 20 minutes. And eventually, if you've ever done an Epsom salt soak on yourself, you'll know that at first it stings, but then it actually is soothing. It really does reduce the redness and inflammation. This is Sansa singing us the song of her people about how she feels about the Epsom salt soaks. But she still got them because I was determined. And this is our boy, again, checking on his kitties. His name is Lansing. And he, like I said, I had to keep them very close to me. So I moved them right into our bedroom once they were no longer contagious. And there was just no keeping him away. This is the lesion on her head. And by now, boy, it was really clearing up. It was very rewarding and gratifying to see that working. What I finally had to end up doing was during her soaks, when she would get to the point that she was relaxed or falling asleep, I would have a Q-tip nearby. I would take that Q-tip and just constantly dip it, rub it, dip it, rub it, dip it, rub it. So it was like I was soaking her head too, but just that lesion there. And it's at this point beginning to get crusty and dried out, which is what we wanted. I really did not want to have to aspirate that thing. I was very worried that if I did, I'd have to have her held still. I'd have to make sure it didn't run down her face when it was aspirated. I wouldn't want to get any of the contaminated fluid in her eyes or nose or mouth. So it actually began to resolve pretty quickly with the addition of the second oral antibiotic and with the really, really soaking it with Epsom salts on a Q-tip. However, she did lose in all the infected spots that were bad with her. She lost the fur. The fur just came out too. She sort of went bald in those areas. I love this picture. This is Sansa sleeping in one of her soaks. I started to joke that it was like a little spa day for them. They would purr too. They would sit in there and be purring, and then they'd drift off and fall asleep. So that was Sansa. And that's Aria. She looks like a little alien kitty. This was her favorite way to take her soak. She'd curl up in a little ball and sort of float. You can see the paws, the toes looking quite a bit better, and that lesion on her head looking better. And then there's the paw, the arm, the necrotic spot on the arm again, looking better. There's, every time I would think that that thing was, I had a handle on it, it would actually change. It was just very bizarre. And that's sort of a side view of it. It was definitely smaller at this point. And then there, at this point, I remember realizing, wow, it's sort of a double again. It's two bumps again. And at this point, they were concentrated. They weren't like a big, mushy, soft blister. They were getting a little bit harder. And the fur was coming out exactly where they were. So there's another picture of it. Yet another soak. I feel like I just spent about 2 years of my life soaking these poor kittens. But like I said, they adjusted to it pretty well. And it's getting crusty and dry and minimizing. So I didn't rinse them off after the Epsom Salt soaks either. That's something I would do that the same way again. I didn't rinse it off because I figured if it's beneficial to them to soak in it, leave it on their fur. They felt a little bit crunchy, a little bit, stiff, but they still had the salts on them and it couldn't hurt. And I was soaking them so often. What was the point of trying to rinse it off? I was just going to do it again. So I recall at this point realizing I had some Septra in the house. I was really tempted to use it to try adding it in for a third oral antibiotic to make up their cocktail, just to finally get rid of that thing on her head, because I was worried, like I said, that it would go through a soft spot and get into her brain or something. So I really, really weighed it and thought about it. And this stuff is supposed to now be the go-to medication for humans with very resistant MRSA, and cases of flesh-eating bacteria. So I was tempted, but it is a sulfa drug and they do tend to have more allergic reactions. So I said, no, we're holding our own right now, but I'm going to keep this in the back of my mind. If it flares up again, if it seems to be getting worse in any way, I will probably risk it then. So I did not end up using it, but in the future, if I felt, I would probably try it in the future if the kitten wasn't getting better and I was worried I could still lose them. So this is just a picture of Sansa showing how much everything cleared up. Her nails are almost fully retracted. They still always looked extra pink, in their light areas for the longest time. It took a long time for that to stop. This lesion, by this point, this is November 7th. So this lesion was just starting to, I realized, oh my gosh, we're fixing it. We're resolving it. It's going down. I don't have to lance it. I don't have to, give her more oral medications. It's slowly but surely resolving. This is lancing, snuggling with them again. So this is just a picture of what I was using and how I was doing it. That is the dental tool I described with the little arrowhead sort of a tip. And I would use a shot glass. I would take a scoop of each medication. I believe this one is the Keflex on the left here. On the right is the doxycycline. So one was every 8 hours, one was just once a day. I would take a scoop of each from those little containers and put it in the shot glass, put a little squirt of the milk in, and mix the two together, and then suck it back up into the syringe and give it to the kittens that way. Sometimes I would just get the tip of the syringe wet and dip it, one side of the syringe in the Keflex, one side of the syringe in the doxycycline. And basically the best thing we could do to figure out dosage was just get the whole tip of the nipple covered in powder, try to do half of each medication, and call it good. So this was the first day that Arya was in a soak, and I realized that lesion was almost completely flat. She's sleeping. She was purring here too, very loudly. they got quite used to this routine. And this is afterwards. That lesion is almost hard to even see. Now, this was really interesting. This is when things are getting a lot better, and I could finally get a better look at their toes. They're not so red. I'm not positive because I honestly, who looks at kittens' toes this closely to begin with? But it really looks to me like the flesh has been eaten away really far back on the housing for the claw itself. So what I think happened is the infection somehow started there, then it ate the tissue away even more. So the nails were way more irritated, way more defenseless, took a lot longer to clear them up. At this point, I would say they don't look infected at all anymore, but it looks like there's tissue gone. So my hope was, oh my gosh, I hope that tissue grows back because this is always going to be a big vulnerability for them if it does not. So I hope that tissue can grow back. So I also was very nervous about, I think they were only a couple weeks here still, 2 weeks, 2.5 weeks. I was also very worried about litter box training. If that is all that exposed and it's not supposed to be, will it just constantly be getting infected while they're litter box training, and could everything start all over again? So I was hoping this could be fixed before they started litter box training. So this, let me see if I can see who that was. I believe this one is Aria. Can't tell when I can't see that spot on her head though. But the eyes, that looks like Aria. And this one I believe is Sansa. So same thing. They both had the same thing where it just looks like the flesh was just this. In fact, this toe, I mean, it almost would look like two toes, two separate toes, because the flesh was completely on either side of the claw, but nothing on top. So when you looked at it from the front view, it looked like two separate flappy toes around that sheath. So I'm pretty sure that's what happened here. The bacteria ate the flesh away, and it made it so much harder to clear up and calm down. So this is another after picture. Her little boo-boo spot is starting to fill in with new baby fur, and her toes are looking a lot better. She's saying hi. And her whole face actually doesn't look so smushed. She doesn't have the caveman shelf-like brow over her eyes anymore because the swelling and the lump is pretty much gone. They did do a lot of chewing, and I could tell that as it healed, their toes and fingers, I know they're not fingers, itched a lot, and they would just sort of chew on them and wave them around. That's a little picture of her continuing to improve. Like I said, though, once in a while you get a view of the toes, and like that middle toe there, it really almost looks like two separate toes. And I realize now, oh, it's because there's pieces of meat missing. So this is another view of how they're doing after all these treatments. I believe at this point we were done with the 1 week of doxycycline, and I was just terrified that we were only had a couple days left of the Keflex, and I was just going, oh my gosh, I've already backed off the Epsom Salt Soaks. Now at this point, I think I was still doing mupirocin ointment overnight because they were now sleeping like 5-6 hours a night. I think I was doing an Epsom Salt Soak every other day, and I started to do colloidal silver baths. I would wash them with colloidal silver, and it really did seem to be very soothing. It would clean off any, it's antibacterial, so I was a little worried about just walking around the house or the other cats or anything like that. So I was able to do a much more gentle sort of routine for their skin. Oh, and I forgot to say, through all of this, right from the very beginning, I do Benny Back probiotics. It's in another one of my videos. So I definitely, absolutely was giving them probiotics through all of this in between the antibiotic dosages. In between, I would wait until they'd had antibiotics 4 hours ago, and in another 4 hours, they'll take another dose. So right there in the middle of 8 hours, I would give them some probiotics. So this is, I realized I have to start litter training them. This was at 3 weeks. I opted to go with clumping litter just because it's easier for me to scoop every trace of the pee and poop out of it. Normally, I don't like clumping litter for the first litter a kitten learns to use the box in, but it was easy to scoop everything out and keep it as clean as possible. It worked really well. I just had to, monitor constantly to make sure they didn't try to chew any of it, inhale any of it, and that it wasn't sticking to any of their newly healed areas. And immediately after using the box, I would just take their just take their feet and do a quick little colloidal silver wash just to make sure they were clean and dry. And I also started hitting their feet after all baths and soaks with the blow dryer on warm to make sure I was getting them completely dry without rubbing them too much and irritating them further. This is just a picture. That's Sansa lying down, and that's Arya facing the camera, and her little bald spot was starting to fill in with brand new baby fur quite nicely. There's Sansa. And this is when our female cats finally started accepting them, right around 3 weeks. That is Leela, who has since been adopted, and her new name is Princess Fifi. She is also a Norwegian forest cat, but she's a black one. She is Lansing's sister. And I believe they were about 4 months old. Yeah, about 4 months old at this time. And she started seeking out the kittens and snuggling them. And I know there's absolutely no reason to think this is valid or scientific, but once the female cats started nurturing them and getting interested in them, I felt like that's a sign they're viable, like they can actually live. I feel like when the other cats all reject them, it means, they know they're probably going to die. So now it really made me feel like, oh, I think we turned a corner. This is just a funny picture, what I had to do to help them get in and out of the box. I had to take some of my kids' wooden building blocks and make them a little ramp. They actually litter trained without a hitch at 3 weeks old. Went in the litter box the first time I put them in there to try it and never looked back. No accidents, never went outside the box, never had a problem. That's Sansa looking pretty fantastic now. And that's Arya. It's very cute. Her little bald spot grew back white. She has a white spot right in the middle of her nice organized stripes from where her sore was. There it is. You can see it better there. I made them a cardboard bird box so that if the bigger cats ever get too rowdy or loud, they can go into this little box and the bigger cats can't fit in there and get them. So that's Arya and that's Sansa. And this is Lansing and Arya. And they were 4 or 5 weeks here, and I have already been able to move them to the silica litter, partly because of how closely and constantly we watch them. So there's never been a chance for them to try chewing it or biting on it. And they've been really good about it. They seem to have caught on really quickly that the litter is for going to the bathroom, not laying in, not chewing, not playing around with. So it's interesting that everything else with this litter has been so hard, so labor intensive, but the potty training, wow, couldn't have been better. It's just been a breeze. This is a more recent picture of Arya with her little white spot. And I've come to realize, I think her face, actually, I think she must just be part one of those smushy faced breeds like Persian or something. She must have a tiny bit of it in her because she just has one of those cute little grumpy smushy faces. So this is Arya again with her little white spot, and there's Sansa back there sleeping. And this is Sansa, just to show she actually was the first one to leap down off the litter box. And when I saw her do that, I said, oh my God, there must be no pain for her to be able to do that. And when I would notice extra pinkness around and between their toes, kind of looking pink, and I'd say, oh my gosh, is it getting infected? Is it coming back? What I think that actually was the new skin knitting and healing and growing back, because it really does look like that happened. There she is jumping. So yay, couldn't be a bigger sign of full recovery. And here's Aria, little grumpy, smushy face Aria with her white spot. There she is again. Wait, let's see the feet. Yeah, see the feet? Looking so much better. And this is at 6 weeks. They just turned 7 weeks, so this is a very recent picture. They are happy and healthy and thriving and just doing fantastic. In fact, it sort of looks like Aria might start becoming the bigger kitten. And their feet are actually just big to begin with. I always thought, oh, they're so very swollen. They look huge. Actually, they do have pretty big feet. So I'm starting to think they're going to be big cats. But it looks like Aria might be getting bigger than Sansa, and she was the runt. So that's just always so gratifying to see with the one that you came close to losing. When you have one that almost died and it was the runt, which usually it is, then it actually starts getting bigger than the other kittens. It's sort of like a little paycheck for you. You know you did a good job. You know they really are healed and going to reach their full potential. This is 7 weeks now. This is Aria again, and her feet look fantastic. And this is Sansa, and their nails are fully retracted now. And when I can't get a good picture of the sheath, but it has tissue around it again. You don't have that whole hard sheath exposed anymore. It looks like the tissue did actually grow back. So this is a story with a very happy ending and something I need to remember. Always look for those signs on any new litters that I get. Check over their toes and everything really carefully. If I see lots of areas of very red skin, start thinking that this could be it and keeping a super close eye. And I know my writing's horrible, but these are my notes. So basically, cephalexin, which is Keflex, 500 milligrams is the capsule we had. I think it was whatever you have handy. I think any dosage would have been fine because, like I said, we were using the tip of a nipple's worth. So cephalexin every 8 hours for 14 days is what I did with the Benibac given once daily in between doses of oral antibiotics. Epsom Salt Soaks, I have 2 times daily here. That was toward the end. At the very beginning, when I saw it was spreading and there was already necrosis, I did 4 times a day. Then we backed it down to 2 times a day when I saw that every time I reduced one soaking, the bumps didn't come back, the lesions didn't come back. And that took a while to get there, actually. So the doxycycline, I didn't start immediately. I would now that I know how well it worked. I didn't have any actually when I first got the kittens. I had to get it from my rescue agency. It took a couple days to hook up with her and get it. So I would start them together if I dealt with this again. And now I have some on hand, so I can. So the doxycycline, again, it just happened to be 500 milligram capsules that we had, but that was once daily, and we did that for only 7 days. The other one was 14 days. The mupirocin ointment I did overnight. It's really hard to keep that on them during the day. They track it everywhere. They're in and out of the litter box. You want to put that on when they're laying down and sleeping for a few hours. So, but I did that every day for overnights. Peroxide Soaks on necrotic spots. You don't want to do that any longer than you have to, but I think we had to do that 4 or 5 days in a row to get it to start debriding the dead tissue for her. And then colloidal silver baths when everything else was improved and I wasn't actually fighting infection anymore, but I just wanted to remove potential bacteria and soothe, like when the new tissue was trying to grow back over the nail sheaths, and I wanted to sort of soothe and support that new tissue, but also keep bacteria to a minimum. That's when a colloidal silver liquid or a bar of soap is fantastic. So I still use that. They're 7 weeks now. And if, I feel like, well, if they went in the litter box and stepped in it and it's messy, I still will. I'll just go wash that off with the colloidal silver bar. I won't use normal soaps or shampoos on them because I want something that really supports healing at the same time that it fights bacteria. And I don't want to just use an antibacterial soap, which can be harsh. So I think that's everything that I can think of. It has been quite an experience with this litter. I have learned so much, and I know I will forget